It's the dawn of a new decade. You can be you again with mini dental implants. Do you suffer with loose dentures? Are you embarrassed to smile because you're missing teeth? Mini dental implants will change your life.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
Do it over in a heartbeat.
It's incredible. It is. It's absolutely incredible.
Hello everybody, I'm John DeSciullo and welcome to Innovations in Health. We're talking about the mini dental implant procedure. It will change your life for everybody here in southeastern Wisconsin. And I'm welcoming Dr. Anthony Schwigel from Cloud9 Dentistry. The mini dental implant is 5 times less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. Ladies and gentlemen, you can enjoy the foods that you love here in southeastern Wisconsin. The bratwurst, the Kringles, oh my gosh, the butter burgers, biting into that steak, a corn on the cob, and an apple. The mini dental implant procedure is something that Cloud9 Dentistry and Dr. Anthony Schwigel will change your life with. And Dr. Schwigel, welcome to the show.
Thank you.
And I want to start by saying that the conventional versus the mini implant is something we should address at the very beginning. You have some models to show us the difference. What is the difference?
We do. So really it comes down to the size of the implant. The mini dental implants are much smaller in size, 1.5 to 2.5 millimeters in diameter versus a conventional implant, which is going to be about 3 to 6 or even 7 millimeters in diameter. So when you're looking at a model of the jawbone, you can just kind of see, here we have a smaller hole for a mini dental implant, and here we have a much larger hole. So, you know, it's less invasive, it's quicker, it's easier because we don't have to worry about removing as much bone. We don't have to worry about grafting as many times.
Yeah, so it takes less time, but you'll work with the patient for what's best for them.
Correct. Every patient is unique and everybody's jaw is unique, and we have vital structures we always want to avoid and work around. And so it's good to have options, which dentistry does offer these days. So you want those options available to you.
Yeah, and you'll make that option available at Cloud9 Dentistry. Now, if you have a lower denture, you know, you're used to swimming around at the bottom of the gum and it's very uncomfortable, very unstable. How does the mini dental implant work with a lower denture?
Well, it works in a quite simple way, really, but the mini dental implants are placed into the jawbone, and typically on the bottom we're going to use 4 of those, and that provides adequate stability and retention for those dentures. But there are small attachments that are on the implants themselves, and then we have attachments that get put inside your denture. And once everything is integrated and put in place, then you're able to retain that denture with just snapping it in, and those housings grab onto those implants. So you are eliminating that goop.
The goop. I was just going to say that, you know, so many people that have dentures are used to using that adhesive. They have to use the adhesive because they need to keep it in place. But as you've seen now with this lower denture example, the goop is gone.
Gone. There's no need for it because the goop is helping to hold that denture in position and create suction. But we're no longer relying on that suction now that we have the implants in place.
It snaps into place and it's very stable. And if you're used to having it swim around at the bottom of the gums, it's that titanium post that holds to it. And actually the titanium post, the bone that grows around it, gets stronger in time.
It does. It's called osseointegration, and it happens when the bone grows along the implant surface.
So if you have a lower denture, odds are you probably have an upper denture. The next example, Dr. Schwigel, shows how that sense of taste is going to come back in addition to the stability.
That's a really important one, John. We've had a lot of research in the past few decades that show a lot of taste buds are up in the palate of your mouth. And so we took it for granted until we had more and more people wearing complete dentures that covered up that palate. And then suddenly they couldn't taste anything anymore. So with the complete denture, you have to cover that palate because you're relying on suction.
And with the upper denture example, you showed how that plastic is removed.
It is.
The sense of taste comes back, but also the sense of security because your speech isn't impacted. You're not slurring your words.
Right. No, it helps immensely because we no longer have the bulk of that plastic material that's all the way up in your palate reaching towards the back of your throat. Yeah. Without that bulk there, it's going to feel much more natural. Your tongue is going to have sensations up against the palate of your mouth like it hasn't had in years. And you're going to be able to taste your food. Not to mention the fact that by us being able to trim out the palate here, it really improves those who might have even the slightest bit of a gag reflex when they don't have to put something so far back in their throat.
Yeah, just that sense of being uncomfortable. I can't imagine that. Now, you shared with me a story before we sat here at the anchor desk about a patient that had a very unfortunate situation with their dentures.
Right. So he had his dentures made, and it was years ago now, but he was telling me the story about when he first got them and he was wearing them. This is several weeks after, so everything was even settled and they were done well. But he was at Home Depot just doing some regular shopping, and he had sneezed, and it forced his denture to fly out of his mouth and kind of go skidding across the floor, which of course was traumatic for him and very startling. Although, according to his story, he was able to snatch that denture up very quickly and just scoop it right back into his mouth nonchalantly. He thought nobody had noticed, but there was one small boy that did happen to notice, who was there.
Always that small boy right there.
The whole time he's just tugging on his dad's pant like, Dad, that guy's denture came out, his teeth just fell out of his mouth. And so for the whole rest of that visit, every time they crossed paths in the store, that little boy just ran back over to his dad, a little bit afraid after what he had seen, and just tugged on his pant leg, and Dad, his teeth came out of his mouth. So he was ready for a change. He didn't want that to happen anymore.
No, and I bet a lot of people that have dentures don't want to have that happen at all. And it's probably happened more often than it should.
Oh, it happens. It happens quite a bit.
So if you have a denture, the mini dental implant procedure, as you've just seen, will help you. But there's another level to the mini dental implant, and we're going to call this the fixed on 6 because it really replicates more of a full set of teeth.
Right, I love this one. This is probably my favorite. But the fixed on 6 is going to use implants in much the same way as the hybrid denture did that we just reviewed, except for now we're going to have 6 or sometimes even 8, depending on the bone quality, implants placed in that arch. And then we're going to make the teeth out of a different material. And that's really what the special part is. We are going to make it out of porcelain or zirconia, so this, being a much harder and more natural looking and feeling material, is going to allow us to remove all the bulk of that denture. You don't have that pink acrylic that goes way up under your lip and way up into your palate at all anymore.
Because there's more of a plastic on the denture.
Correct.
This is a much better option.
Exactly. The dentures are plastic, and as good as that plastic is, it's not as good as porcelain or zirconia.
Yeah.
So this is a much longer lasting material and much more natural looking and feeling material than the dentures are going to be made out of. But this gets housings in it much the same way, being much less bulky, and then these are going to snap on those implants in the same way. With 6 or 8 implants up here, this is not something that you're typically going to be removing on your own at home. We'll follow up with you, every 3 to 6 months for cleanings and whatnot, and we'll take a look at things if we feel like we need to remove it to clean around implants or assess gum health, and we'll do that. But this is a permanent option. And this is a great option.
Yeah, it's beautiful looking, and you can do the upper or the lower.
Correct.
Or both. And we have another great example for a mini dental implant. We were born with our baby teeth and then graduated to adult teeth, and now Dr. Schwigel and his team at Cloud9 Dentistry are going to give us our 3rd set of teeth with this roundhouse example.
So the zirconia bridge option. Again, same material as that fixed on 6, but now we're going to cement it in place permanently. So it's going to require more implants, so 10 to 12 implants, and that's to provide support for this material. But then we're going to have this directly cemented over those implants. So this is not coming out.
And how do you care for the mini dental implant?
Very much the same way you care for your normal teeth. And so we always want to make sure that we have healthy gums, because the bacteria that cause gum disease can become the problem for implants as well. And so you're going to care for those by just regular brushing of the prosthesis. And then we're also going to use floss and water picks. Water picks are probably the most popular method of cleaning underneath these bridges and these dentures.
So if that is a mini dental implant that you need, Dr. Anthony Schwigel and his team will work with you. But Doc, sometimes we have teeth in the back of our mouth and they're out of sight, out of mind. Maybe they've fallen out or they're just not right. Folks, those are the workhorse teeth. Those are the teeth that chew all the food and get all the nutrients out. So the mini dental implant can help fix those teeth. Show us how.
Correct. So if we're missing teeth in the back, we have the bone there to do it. We'll be able to place mini dental implants in those spaces where we're missing those teeth. And then we're able to then fabricate crowns and bridges that are going to go right over these implants and cement permanently in place, so you're not taking these out. These are cleaned just like your normal teeth. Brushing, flossing, water picking, and right away you restore your chewing partners, you restore your back teeth, which is going to provide support for your front teeth and support your face and allow you to function better.
As we noted, those teeth are the workhorses, because if they're not there, then the patient naturally gravitates toward using their front teeth to do the chewing, and that's not what they're made for.
They do. No, you're going to get by with whatever you have. And what people don't understand is that when you start losing back teeth, which are usually the first ones to go, and you don't replace them, it is just a matter of time for most people before the front teeth start to get destroyed, because they're being used in ways they're just not designed to be used, and they don't hold up to that over the long haul.
And speaking of front teeth, if you have a tooth that's in the front, and this, by the way, is for anybody of any age, there's nothing more embarrassing than having a missing tooth.
Right.
And it could happen for a number of reasons: a sporting accident, a fishing accident, just bad bone, bad tooth. The mini dental implant will custom make a tooth just for you.
Right. So just like if you had a tooth in there still and you were having cosmetic work done, or you were having crowns or veneers made, we're going to use the same workflow process and materials to make a crown that's going to fit over the mini dental implant that's placed in that position. And so that crown is then just going to get put into place and be cemented there.
And this is a custom-made tooth, isn't it, Dr. Schwigel?
It
This
is.
is not something that comes out of a box and
No.
is placed into the patient.
No, these are designed and made after the implant is in there, and after you've had an opportunity to heal, and that way everything is stable and it's going to look as good as can be.
The mini dental implant procedure, you've seen it right here with Dr. Anthony Schwigel. It's going to change your life, and it's an in-office procedure at Cloud9 Dentistry. They are a mini dental implant center of America at 3079 Village Square Drive in Heartland, Wisconsin. Here's the number. It's on your screen. Write it down. Share it with your friends and family. You want to make the call to 262-266-1065. And online, you can find out more at cloud9, the number 9, dentistry.com. So remember, everybody, from Milwaukee to Madison, Kenosha, Racine, Green Bay, we are here to serve you at Cloud9 Dentistry. We promised that we were going to get to know Dr. Anthony Schwigel, and you are a Wisconsin guy, aren't you?
I am. Grew up in Milwaukee, Wisconsin.
Yeah. So this is the great state that we are in, and we love the people here, and I know it's important to you to work with those patients to make sure they look their best.
Absolutely.
And tell us about your family.
Well, we have 6 boys, ranging in age at this point from 2 to 13. And
6 boys, Doc. Wow, what a
very
busy household you have.
Very busy.
That's terrific. And I bet they all have good smiles.
Very good smiles.
Yeah.
Very good.
How
No
are they-
cavities yet.
How are they with brushing their teeth? Has that been an issue?
Pretty good.
Okay,
Pretty good.
And I have to thank you for your service, because you were in the Navy, and you served at Camp Lejeune, I believe. Tell us about your service work.
So after graduating school, I went to Camp Lejeune after Officer Developmental School, and I was a Navy dental officer for a little over 4 years. I elected to station with the Marine Corps the whole time, so I had a lot of great experiences, met a lot of great people, got some opportunities to get out in the field and do a little very intense camping, a little blowing things up, a little getting taken on helicopter rides, and got to experience a lot of things I wouldn't have otherwise been able to experience, while at the same time acquiring a lot of really good training and being able to serve a lot of those guys who are out on the front lines.
Yeah, very important. And I know a lot of our viewers are vets that are watching, and they certainly, as I said, thank you for your service. Where did you go to school?
I did my dental school at University of Minnesota, so right in Minneapolis, not too far from here, and that is where my wife was from. So it worked out well. We were able to kind of stay around family the whole time.
Yeah. So with school, you went to school, got your degree, came back here to Wisconsin, and I know that the mini dental implant procedure is where we're going moving forward with Cloud9 Dentistry.
Correct.
And all of that information about the mini dental implant and the technology, there's an individual who I know you work with in Buffalo. You skip across the Great Lakes and visit Dr. Todd Shatkin. Tell us about Dr. Todd and what you learn and what you bring back here to Wisconsin.
Well, I met Dr. Shatkin about 1.5 years ago, and it was while attending a continuing education course up at his facility in Buffalo, where he's been kind of pioneering the mini dental implant procedures since, 1985?
Long time.
1990, about 25 years. Yeah. So he really has quite an extensive resume of using mini dental implants to treat all sorts of things, and so he's been a wealth of knowledge and training and a great resource.
And it's great that you get that technology, because you're always learning, aren't you, Dr. Schwigel?
Correct.
Yeah.
Everything's always changing.
Yeah. And I know you're going to work with the patient. We talk about buying a car and you pay for it on time, you have a mortgage on your home, and the mini dental implant is an investment in you, and you're going to work with the patient to make it affordable. How do you do that?
Right. Well, just by the nature of being a mini dental implant, that's going to make it more affordable right there. But then also we partner with multiple finance companies, and it's just in an effort to be able to make options available to you so that they can find a solution that's going to make it affordable for you.
Yeah, and you work with that patient because you do a free consultation, I'm to
We do.
understand. Yeah.
We do.
What do you talk about in a consultation?
That's kind of where we get to know the person. I love the consultations. We're going to take a 3D scan, which we haven't talked about yet, but we'll get there, and that's going to allow you and I to sit down and walk through, and you're going to understand things about your jaws and your teeth that you probably haven't ever seen before. And so that's going to really be an educational opportunity for both of us, me to get to know you, you to get to know me, and you to get to know you a little bit and what your needs are, and we'll come to some conclusions on what you would like, and talk about what's going to be best for you.
Yeah, whether it's a mini dental implant or other dental procedure that's needed. You mentioned 3D. The cone beam technology is what we're alluding to there, and it sounds like something out of a sci-fi movie, but it's the latest technology to get a look inside the patient without that clay, that goop that you do the models with. But this is, again, something that Cloud9 Dentistry offers that's unique as a mini dental implant center of America.
It is. It really allows us to be more accurate. We can diagnose better because we can see things with cone beam that we could not see with traditional x-rays, and that's going to allow us to be able to watch out for vital structures like nerves, sinuses, and also we know exactly where the bone is. So we'll sit there and we'll put implants in virtually right into your jawbones with that 3D scan, and you'll see for yourself exactly how things are going to go.
It's fascinating stuff, and this is the advanced technology that dentistry now has. And if you have not been to the dentist for whatever reason, you really should call and make an appointment at 262-266-1065. And I know, Dr. Schwigel, a lot of people haven't been to the dentist for a number of reasons, but you offer a sedation in case the patient needs that help along the way.
Right. I would say the majority of people are just very happy and comfortable, and we're able to just work together and not use any sort of sedation outside of the regular anesthesia that we would give you for a filling. But in those cases where we've had experiences that have been negative from past experiences at the dentist, or we just have high anxiety, that oral sedation can really calm people down and make it so that you're floating on cloud 9.
Yeah, cloud 9, therefore Cloud9 Dentistry. And doctor, we talked about dentures, and some people who are of a certain age, they maybe figure, well, I've got a denture, I just have to resign myself to that kind of life for the rest of my life, and that's not the case. Imagine when you bit into your first Kringle and how that tasted, and now you can have that taste sensation back. So age should not be an issue. No matter what your age, you'll work with the patient so they can enjoy the rest of their life with their smile and enjoying the foods we love here in southeastern Wisconsin.
Right, it really is important. I mean, there is no age at which you're not going to have to eat food, and it's just going to frustrate you if you can't eat it easily. You want your mouth to be healthy, and you want whatever you're using, whether it's crowns, the bridges, the dentures, to function for you so that you can enjoy life and not have to worry about what's going on in there.
Yeah, it's a made in America product, everybody. So from, as we said, from Milwaukee to Madison, Racine to Green Bay, Kenosha, everywhere in between, Dr. Anthony Schwigel and his team at Cloud9 Dentistry are here to serve you. They are a mini dental implant center of America. It doesn't get any better than that at 3079 Village Square Drive in Heartland, Wisconsin, not far from anywhere. 262-266-1065 is the number. Cloud9 Dentistry and the number 9.com is the website. Let's talk, Dr. Schwigel, about some of your patients, because you've changed their lives. And I know you want to share some stories about some of those patients and how they've been impacted by the implant procedure.
Right. So, I mean, from the very basic, somebody who comes in having lost all their teeth maybe years ago, and they've had dentures that have been ill-fitting, they come in and we're able to just convert those dentures to hybrids very quickly, and suddenly they're comfortable and they're not falling out of their mouth anymore. So they immediately get that sensation of tasting back. They immediately get that confidence back of being able to eat and speak and be out in public without having to worry about if they forgot their denture adhesive, or getting back in home or carrying their denture case with them because they might have to take them out and put them somewhere. And so everything from that to, one lady I think of had no back teeth on the top and only her front teeth on the top, and she had been like that for years, and so her bite was all collapsed and she had very little function. Her front teeth were starting to suffer because she was having to chew on them. And so we looked at things, and she was a great candidate for these implants, and so we put some implants in and implant bridges on the top right and left in the back, and within a short period of time she was back to being able to chew with a full set of teeth. Life-changing.
That's amazing. And I would imagine as a dentist, that's very gratifying for you when somebody gets that reveal and they see
Right.
not only their smile, but the sense of security that either their denture isn't going to fall out or they're going to be able to chew and eat again.
Right. We love when things work and they work well.
Yeah. Well, Dr. Schwigel has some great stories, but let's hear from some of you who've had your lives changed with the mini dental implant procedure. Let's take a look.
I had a lot of difficulty in eating.
I had crowns in the upper part on my right side.
I had a cracked temporary crown.
I lived for many years with 2 partials.
I wanted something that was a little bit more permanent.
I had missing teeth.
If it's not working, it's probably time for implants.
I need to go to a dentist that I trust.
I found Dr. Schwigel.
He really listens to what you ask.
I didn't have any pain.
They were very professional.
There was no pain, no discomfort whatsoever.
It didn't hurt.
Oh, it's wonderful.
It's great.
It's actually really painless, and I wish I would have got it done a long time ago.
So I did it, and I'm very happy with it.
It's made a tremendous difference.
I can smile with more confidence. I can eat.
I can eat steak, I can eat sandwiches.
I don't have any problem chewing anything.
Nuts, apples, you name it, I can eat it.
I'm very, very pleased that I have them now.
Which is good because I do love to eat.
If you need somebody and you need another opinion on things and you're tired of where you're at in life and you think you can make another choice, he's a great dentist to come to.
Yes, I'm very happy with it. It feels like the real McCoy. It feels like the real thing.
The mini dental implant is 5 times less. They're less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. We talked about the affordability, but let's talk about the less discomfort, Dr. Schwigel. An over-the-counter medication will do it for somebody that has very little discomfort, really.
Right. We want to prescribe as few addictive drugs as we can.
Yeah, we don't want to
just
do that.
across the board in healthcare. And so by being able to do minimally invasive surgeries, that's going to allow us to be able to create smaller wounds, which are less painful. And we're going to be able to treat those and manage that pain very well with just Advil typically or Tylenol,
So an ibuprofen or something that would be over the counter if needed at all.
Right.
And we talked about the care, and you offer a water pick, don't you?
We do.
Flosser.
We do. We want you to be successful with these implants, and so we have those right in the office. And most of these cases, you're going to get one of those given to you, so that you can take care of those implants.
And speaking of the implants, as we mentioned, we want to show again. First, we'll start with the difference between a conventional and a mini, showing the jawbone example. This is pretty dramatic as to seeing the difference.
Right. So this is just a model of the lower jawbone, and you have 2 holes in here, and this is the size hole that's made for a mini dental implant, while this is the size hole that's made for an average conventional style implant.
And it takes longer with the conventional. So you'll work with the patient on what's best for them, the conventional, the mini. The mini, by the way, is less expensive, as we mentioned, and certainly less visits to the dentist, but you need to go see Dr. Schwigel and an in-office procedure. But now if you have a lower denture, and as we said, it's swimming around on the bottom of the gums, if you're out there and you know what we're talking about, take a look at this and how it's going to stabilize.
Right, these are my favorite. These dentures that you already have or you need to get new ones made and they're swimming around in there, we just place these implants, typically 4 on the bottom, 6 on the top, and that's going to allow us to then put housings inside the denture, and that is going to snap right in place so that we can eliminate the use of all of the denture adhesive, no more of the goop for you, and then we're going to have a nice, secure denture that isn't going anywhere.
Yeah, that's terrific, and that sense of stabilization, very important. Now, odds are if you have a lower, you probably have an upper denture, and as we mentioned earlier, we can't say enough about the great foods we love here in southeastern Wisconsin. So imagine biting into that steak, then apple, the butter burger. Show us why the sense of taste comes back, Dr.
Right, well, as you can see, if we flip the model this way, we see a hard palate right here, and there are a lot of taste buds in that hard palate. And so with a traditional denture, that's going to be covered all the way to back here by plastic. By putting implants in on the top and those same housings that we use on the bottom, we're able to now secure that denture in place using the implants instead of the goop or the suction on the palate. And so that's going to allow us to trim out the whole palate from that denture so that you can have access to those taste buds, create room for your tongue again, help your speech, reduce the gag reflex tendency that some might have, and just provide better overall comfort and function.
Terrific. So if you have a denture and you've resigned yourself to the fact that you have to live like that with the goop is gone, everybody. Now, there's another option. We're calling it the fixed on 6, and this looks terrific.
This is one of my favorites. So this is very similar to doing the upper denture in the sense of we're going to use 6 to 8 implants on the top or the bottom. And instead of making the teeth out of plastic, which is what your denture is going to be made of, we're going to make them out of porcelain or zirconia. And this, being a much harder and stronger material, is going to be easier to clean, less bulky, and we're able to retain that in much the same way. However, with 6, 8 of these under there, using these materials, this is not something that you're going to need to take out at home. So you'll just be following up with us, and we'll do any removal and cleaning under that. You'll be cleaning under it like normal teeth, water pick, floss, brushing.
And coming in to see you and your team at Cloud9 Dentistry for a checkup. You know, as we've seen with the mini dental implant, we were born with our baby teeth, graduated to the adult teeth, and now Dr. Schwigel and his team at Cloud9 Dentistry are going to give us our third set of teeth.
So with the roundhouse, it's going to require 10 to 12 implants on the top or the bottom. And if you're able to have all those put in there, then we can take and make, again, this porcelain set of teeth, and this is going to cement permanently over those implants. And this does not come out.
Looks terrific.
Looks terrific.
Yeah, imagine the smile that the patient has when they open their mouth and bam, there's a brand new set of teeth, upper, lower, or both. Now, the teeth that are in the back, if you're neglecting those teeth, it could lead to all kinds of problems, can't it, Dr. Schwigel?
Absolutely, and we talked about some of those earlier in the program, but you know, here we are with missing back teeth, and it causes instability between all of the other things in that area. Also, you could have collapsing of your cheekbones, making you look older than you are. Loss of function is a big one. And so by putting mini dental implants in the posterior area, we're able to then make bridges and crowns that we can then cement right over those, and now you can eat again.
Looks great. And if you have a missing tooth in the front, take a look at this, because the flipper, you know, the old TV show with the dolphin, that's gone. The flipper is gone because you have a permanent solution.
Right, so in those cases of missing front teeth, we can put the dental implant right in, and then we can make a custom-made crown that's going to blend right in with the rest of your teeth out of the same nice porcelain materials that are very aesthetic, and that's going to get cemented permanently to that implant, and it will not come out.
Yeah, and I would suspect, you know, somebody that has a missing tooth, you can't go through life like that. You have to have your teeth, you have to look good, you have to have a smile that resonates.
Right, it's all about confidence and feeling like you are you.
Yeah.
People had teeth, and if things have happened that have caused them to be lost, that's going to affect your confidence, and that's going to show through.
Yeah, well, you can be you again with the mini dental implant procedure. Dr. Anthony Schwigel and his team at Cloud9 Dentistry, a mini dental implant center of America, 3079 Village Square Drive, Heartland, Wisconsin. The phone number 262-266-1065. Cloud9 Dentistry with the number 9.com is where you want to go to online and find out more information. Dr. Schwigel, how did you get motivated to become a dentist?
Since about 4th grade, I wanted to go into heart surgery, but it didn't allow for a great family life. And so I just thought one afternoon, hop across the parking lot and visit with a dentist. So I went over there and spent an afternoon, and I loved it. It was great. I was doing little surgeries, and you were getting to connect with people in a different way because you established relationships that were lasting sometimes for decades.
Yeah. Well, great family life, very important with 6 boys. That's very important. Yeah.
Right.
Well, Dr. Schwigel, you are an innovator in health here in southeastern Wisconsin, in our great state, and appreciate you being here on Innovations in Health. Continued good luck to you.
Thank you.
Thank you, and thank you for watching.